Okay, so here's what I want to do. Look at some quality improvement methods tools and look at how we might use these tools. So a couple of the things I want to talk about: what's the impact of the design, the system design, how the system's design on quality and patient safety, what kind of leads to, and here's where I have a couple spelling mistakes, so my apology, high risk situations and errors. Oh, look at dots, and can you tell it must have been late at night. What methods can be used to identify improvement opportunities, and what, most importantly, what's the role of the clinical leader in improving quality? And I almost always talk about quality and safety together. So here's just a little slide of things that we know. Like, what do we know about quality? Like we know an awful lot about quality. Right? We know an awful lot about what makes a high quality intervention, process, activity. We really do know a lot of stuff. And it can just go on and on. And in fact, the evidence there's so much evidence in the literature, it's so hard to keep on top of it, don't you find? Or, there's just more and more and more stuff, more and more journals, publishing more and more insights. And part of the gap often is, how do you get those things into practice? The space is getting really crowded out there. So why are we interested in this anyway? Does your job depend on it? Bobby? Will you believe in what that's why we want to improve?
Yeah, we want it to be really good.
We want it to be really good.
We want people to get the best. Change, going forward.
Going forward?
Yeah, going forward in healthcare, making it better.
Making it better. Okay.
Better for patients.
Better for patients. Right. It's better. Did we always, how long has this been on the radar? This stuff.
Always, but I think it's more important today because of the dwindling resources. We're still trying to do more with less.
More with less.
But quality can't be compromised. We're dealing with patients and people.
Right. Right. Pardon me?
Consumers are more informed too, so
Ah.
they ask more questions, may not come with more answers.
Right. Right. Consumers are more informed. They have access to more information. And do they know how to interpret that information? Sometimes. Aaron?
They have rights.
Rights. Oh, rights have become a very, right. They're changed, right? And with those rights have changed responsibilities and changed knowledge about how to apply those. Okay. So what does quality mean to you? Continuity? Throw out words? Safe. Yeah? Pardon me?
Best practices.
Best practices, evidence-based.
Improve quality of life.
Quality of life as an outcome. Improved. Client-centered.
Essential.
Essential.
Quality is essential.
Quality is essential to our work. Okay?
Positive patient satisfaction.
Patient satisfaction, patient viewpoint, patient feedback. The right thing.
Being effective.
Being effective. How do you know if you're effective?
It's tied to outcomes as well.
Tied to outcomes. Yep. Okay, so and do you think quality means different things to different stakeholders? Like, that's kind of a bit of a giveaway question, isn't it? And I think it's another thing that we're increasingly aware of, that we haven't been aware of in the past. I mean, I really suggest to you that at least 15 years ago, for sure, there wasn't the emphasis there is now on consumer feedback, client feedback, satisfaction, that sort of stuff, client involvement. And that's just some of the clients, right? We see so differently now the different this is one of the issues in working in multi-professional, interprofessional teams, is that we can have, we don't just come from silos, but we can have siloed perspectives on what the outcomes are supposed to be or what the quality measures need to be, right? So sort of like what Jonathan was talking about this morning, siloed values maybe as well. So values are really tightly linked with outcomes. And with that, of course, comes how do you mediate the differences? So you've touched on these things, more and more evidence out there, and how do we get that evidence about best practices into practice? How do we, we need objective tools to be able to assess the effectiveness of our work. And then, of course, I've said the need to translate research into practice. But we're living in this world of increased accountability, is maybe some of what you're saying, Pauline. We're in this environment of increasing accountability and responsibility for, especially from the payer's perspective around what the outcomes are.